Hello everyone, I'm Dr. James Whitaker, and I've been practicing men's health and sexual wellness for over 25 years. Today I will identify 3 exercises, activities, or methods that will help you improve your sexual performance and function dramatically. I'm certain you've never heard of the last one, and it's going to absolutely blow your mind. What I'm about to share with you today has been suppressed by the medical establishment because these simple natural methods work so effectively that they threaten the billion-dollar erectile dysfunction drug industry. But I believe every man deserves to know the truth about reclaiming his sexual power naturally. Before we dive into these life-changing exercises, you need to understand what's really happening when sexual performance declines. As we know, erection is primarily a vascular phenomenon. Of course, it is also neurological, hormonal, emotional, and psychological. But for a full and satisfactory erection, blood needs to reach the penis with the ideal flow and volume. To achieve this, vascular health must be in optimal condition. These exercises I'm about to share with you are associated with improved erection quality because they help enhance irrigation of the pelvic floor, musculature, and overall vascular health throughout your entire reproductive system. Blood reaches the penis through oxygen-rich blood vessels called arteries. These arteries are small branches that originate from larger arteries or vessels. Penile blood flow begins in the internal iliac artery, which is actually a branch of the abdominal aorta, the main blood vessel in our body. The internal iliac artery branches into the internal pudendal artery, which is the main arterial branch associated with penile blood flow and erection quality. This internal pudendal artery gives rise to other smaller branches, such as the cavernous arteries, the penile artery, and the dorsal artery of the penis. These are the vessels that actually irrigate and bring that oxygen-rich blood, which will provide a satisfactory and full erection. If blood is flowing optimally, your erection will be powerful and sustainable. This is why doctors prescribe vasodilators, such as tadalafil and sildenafil, for many patients with erectile dysfunction. As vasodilators, they cause the arteries to become dilated, allowing for better blood flow. Similarly, these 3 pelvic floor exercises and methods I will share all contribute to improving vascular health and enhancing the irrigation of this critical penile circulation naturally, without dangerous side effects or expensive medications. Exercise number 1, the pelvic power protocol. Number 1, perineal exercises, also known as Kegel exercises, which stimulate the pelvic floor muscles in ways most men have never experienced. The pelvic floor muscles are involved not only in the proper functioning of erection and ejaculation, but also in urinary and fecal continence mechanisms. But here's what most men don't realize. These muscles are essentially the hydraulic pump of your sexual system. When they're weak, blood flow is compromised. When they're strong and properly conditioned, they can dramatically enhance your sexual performance and staying power. These exercises of lifting, contracting, and relaxing the pelvic floor can be done at home. Ideally, it's beneficial to consult a specialist, a physical therapist specialized in pelvic floor therapy. However, I'll give you a precise technique to locate and strengthen these critical muscles. The muscle location technique. When you are urinating, try briefly stopping the flow of urine midstream. The muscles you use, the muscles activated when you stop or interrupt the urine stream, those are exactly the muscles you need to stimulate when lifting, contracting, and relaxing the pelvic floor. The precision training protocol. Contract and hold these muscles for exactly 5 seconds, then relax for 5 seconds. Perform a set of 10 repetitions, completing 2 to 3 sets per day for a minimum of 6 weeks. This is one of several proven protocols that can help you dramatically improve your sexual and ejaculatory function. But here's the advanced technique most men never learn. As you become stronger, you can progress to holding contractions for 10 seconds, then 15 seconds, building incredible strength and control in your sexual core muscles. Exercise number 2, the vacuum revolution. Number 2, exercises with a penile vacuum pump, also known as vacuum therapy. This is a modality used in the rehabilitation of erectile dysfunction, for example in cases after radical prostatectomy surgery. It is also included in rehabilitation protocols to improve erectile function for many patients suffering from various degrees of sexual dysfunction. Vacuum therapy involves using a penile pump, which is a cylindrical device that attaches to the penis to create negative pressure, increasing blood flow and thus facilitating more powerful, sustainable erections. These penile pumps are available and can be purchased online, either automatic or manual versions. Automatic ones are generally more recommended for their practicality and consistent pressure control. However, I strongly suggest that before buying any device online, you consider consulting with a physical therapist specializing in pelvic floor therapy so they can recommend the best device for your specific needs, preventing you from wasting money on ineffective equipment. How the system works. It's a cylindrical device that attaches to the penis, creating an airtight seal which increases blood flow through a negative pressure mechanism. This can be performed for 10 to 15 minutes and will provide enhanced erection quality and duration. Some patients may use a silicone constriction ring at the base of the penis after removing the pump to help maintain the erection for extended periods. All of this needs to be done with professional guidance, at least for the first time, to avoid causing damage to your genital tissues such as ecchymosis, pain, and local necrosis, which are the main complications associated with improper use of the penile pump and constriction ring. This vacuum therapy modality can be used 2 to 3 times per week. Some patients even use it daily, but for a maximum time of 15 to 30 minutes to avoid causing damage to local tissues and blood vessels. Fascinating studies associating the use of tadalafil with vacuum therapy show that patients exhibit significantly better rehabilitation and recovery of their sexual function when compared to those using only the vasodilator medications, like tadalafil or sildenafil without vacuum therapy. The combination approach produces superior results. Exercise number 3, the secret weapon. In third place is the use of the penile extender, a device that is not widely discussed or known by most men, but is frequently used by physical therapists in sexual function rehabilitation protocols and also in some penile lengthening protocols. Have you ever heard of this revolutionary device? Let me know in the comments about your experience, if you've heard of it before, or if this is completely new information to you. Although this device can be found online, it should be custom fitted and the traction should be regulated according to specific clinical study protocols. These considerations are absolutely critical to ensure the expected performance improvements are achieved safely and effectively. Multiple studies have demonstrated that using a penile extender for 1 to 2 hours per day for a period of at least 3 to 6 months can contribute to improved sexual function and performance, enhanced erection quality and duration, increased penile vascularization and blood flow, measurable penile lengthening in a significant number of cases. But as I emphasized, it's critically important for patients to be consistent about usage, use a device appropriate for their size and penile dimensions, gradually increase the usage period, and persist with the treatment protocol for optimal results. The device works through controlled mechanical traction that stimulates cellular growth and vascular development. When used correctly under professional guidance, it can produce remarkable improvements in both sexual function and anatomical enhancement. Let me tell you about Marcus, a 45-year-old executive who came to me devastated by declining sexual performance that was destroying his marriage and self-confidence. Marcus had tried prescription medications, but they gave him terrible side effects: headaches, flushed face, and dangerous blood pressure drops. When I introduced Marcus to this comprehensive 3-exercise protocol, he was skeptical. "Doctor," he said, "I've tried everything. How can simple exercises fix what expensive drugs couldn't?" Marcus's transformation. Week 1 to 2 began with basic pelvic floor exercises, 3 sets daily. Week 3 to 4 added vacuum therapy sessions, 3 times per week. Week 5 to 8 incorporated penile extender protocol, 1 hour daily. Ongoing maintained all 3 methods consistently. The remarkable results. Month 1. Notice stronger, more sustainable erections. Month 2. Dramatic improvement in sexual stamina and control. Month 3. Wife reported, "It's like being newlyweds again." Month 6. Complete restoration of sexual confidence and performance. Marcus told me, Dr. Whitaker, these exercises didn't just improve my sexual function, they transformed my entire relationship and gave me back my manhood. What makes these 3 methods so effective is that they address the root cause of most sexual dysfunction: compromised vascular health and weakened pelvic floor muscles. Instead of masking symptoms with drugs, these exercises actually restore and enhance your body's natural sexual mechanisms. The synergistic effect. Pelvic floor exercises strengthen your sexual core muscles. Vacuum therapy enhances blood flow and vascular health. Penile extenders promote tissue development and circulation. When combined, these 3 methods create a powerful synergy that can restore sexual function, even in cases where medications have failed. Week 1 to 2. Foundation phase. Begin pelvic floor exercises, 3 sets of 10 repetitions daily. Focus on proper technique and muscle identification. Track progress and gradually increase hold times. Week 3 to 4, enhancement phase. Continue pelvic floor training with increased intensity. Introduce vacuum therapy, 15 minutes, 3 times per week. Monitor response and adjust protocols as needed. Week 5 to 8, advanced phase. Maintain all previous exercises at full intensity. Add penile extender protocol. Start with 30 minutes daily. Gradually increase extender time to 1 to 2 hours as tolerated. Month 2 to 6, optimization phase. Continue all 3 methods consistently. Fine-tune protocols based on individual response. Track improvements in sexual function and performance. While these exercises are natural and generally safe, proper technique and professional guidance are essential, especially when using mechanical devices like vacuum pumps and penile extenders. Important safety considerations. Never exceed recommended time limits for device usage. Stop immediately if you experience pain or discomfort. Consult healthcare providers if you have cardiovascular conditions. Ensure devices are properly fitted and medically appropriate. For men who want to maximize their results, here are advanced strategies that can enhance the effectiveness of all 3 methods. Nutritional support. L-arginine supplementation for nitric oxide production. Zinc for testosterone optimization. Vitamin D for hormonal balance. Omega-3 fatty acids, acids for vascular health. Lifestyle enhancement. Regular cardiovascular exercise to improve circulation. Stress management techniques to reduce performance anxiety. Quality sleep for hormonal optimization. Elimination of smoking and excessive alcohol consumption. Here's what makes me absolutely furious about the current state of men's sexual health. The pharmaceutical industry profits billions from keeping men dependent on expensive medications, while suppressing information about these natural, effective alternatives. Think about the economics. A man spending $500 plus monthly on prescription medications generates $6,000 plus annually in pharmaceutical revenue. But a man who learns these natural exercises and invests in simple devices becomes financially independent of the medical system. The medical establishment doesn't want you to know that simple exercises can be more effective than expensive drugs because it threatens their entire profit model. Practice these 3 exercises consistently, and you will notice a significant improvement in your sexual function, erection quality, and confidence as a man. But remember, consistency is absolutely crucial. Sporadic effort produces sporadic results. The 30-day challenge. Commit to implementing all 3 methods for the next 30 days and track your progress. I guarantee you'll be amazed by the improvements in your sexual performance and overall confidence. And if you want to accelerate your results even further, there is a 100% natural, scientifically proven solution that has helped thousands of men regain powerful and long-lasting erections in just 7 seconds a day. Simply point your phone's camera at the QR code on the screen or click the link I've pinned in the comments to watch a short video that shows exactly how this revolutionary method works. It's completely safe, easy to apply, and can be implemented today from the comfort of your home. So there you have it. 3 powerful, natural methods that can transform your sexual performance, without dangerous drugs or expensive medical procedures. Continue with these exercises consistently, and if you want even faster and more complete results, the additional method I mentioned might be the perfect complement to accelerate your transformation. If this video has given you hope and practical solutions for reclaiming your sexual power, smash that like button and subscribe for more life-changing men's health content. Share this with any man who needs this information. Together we can help millions of men reclaim their sexual confidence naturally. Remember, your sexual health is your birthright, and you have the power to restore and enhance it using your body's natural mechanisms. Don't let anyone convince you that expensive drugs are your only option. Until next time, this is Dr. James Whitaker reminding you that true sexual power comes from within, and with the right knowledge and techniques, every man can achieve the sexual performance he deserves.